Okay, all good?
Okay. 5, 4, 3, 2, 1.
Thank you. Well, very pleased to be able to say that there are 0 locally acquired cases of COVID in Queensland today. However, 3 new cases in hotel quarantine, which I'll leave for the Chief Health Officer to talk more on when he addresses you. However, today, when we're standing here on the set of A Christmas Carol, I can safely say it's starting to look a lot like Christmas. And of course, the best chance of being able to all be together this festive season and enjoy our freedoms, like being able to come to one of the many Christmas events here at QPAC, is to get vaccinated. Vaccination remains our key to Queensland's economic recovery, and as we see our borders in just a few weeks' time open to the rest of the country, and of course some of those necessary mandates being put in place to keep us all safe, proving that you're vaccinated will be very important. So to make it easier for businesses and Queenslanders to prove that you've been vaccinated, you can now link your COVID-19 vaccination certificate to your Check in Queensland app. More than 700,000 Queenslanders have already done that. It's a relatively easy process. Just make sure that you update your app first and then go to the menu at the top left-hand corner of your Check in Queensland app. Tick on the COVID-19 digital certificate, follow the easy steps, and then what you'll see is a green tick on the front page of your Check in Queensland app, which will assist you when it comes to the mandate that we'll see come the 17th of December. Of course, 17th of December, we will need to be able to prove that we're vaccinated. That will be required at some places and locations across Queensland as part of the mandates to ensure that we're all kept safe. So get into the Christmas spirit, get vaccinated, and of course get your green tick to be able to enjoy a white Christmas here at QPAC. Cue the snow. So I'll hand over to the Chief Health Officer to talk more. Thank you.
Thank you, Minister. As you've heard, 0 locally acquired cases in Queensland today, which is wonderful news. 3 new cases, they're interstate arrivals that are in hotel quarantine, and they've arrived on day 1. So there are some venues of concern that we have flagged on the website just for people to have a look at. If you've been in any of those venues, and that's the gate that they arrive, the luggage carousel or the bathrooms, please just come forward and get tested. That's the big ask at the moment. The other things, there's been testings, over 7,000 tests, 7,126 tests done yesterday. Vaccines, almost 10,000, which is great, 9,587. And that brings us up to first dose of 86.05% of Queenslanders, and for second dose, 75.72%. The other things that we need to talk to you about is the emergence of the new strain. As we've said, WHO has declared this a variant of concern, and the Commonwealth has met yesterday, the HPPC met yesterday, will meet again today, and the number of measures the Commonwealth has put in place. These are all sensible measures to buy us time, because at this stage this is a new virus and we don't know the details of what it means for our communities or anybody else at this stage. The things we look at is how infectious or how transmissible the virus is, the severity of illness and its impact on testing, vaccination or other treatments. We need time at this stage to get that information from South Africa. We need to be cautious, but we don't need to be alarmed. It certainly does look like it is becoming the dominant strain in Johannesburg, but we have no information yet about whether it's more severe in illness. If it's not more severe in illness, there really isn't very much to worry about, and particularly if there's no breakthrough in vaccine. And it's early days, we need to wait and see. The other thing you will have seen is there has been a fire in a hotel quarantine in Cairns. Everyone has been evacuated, everyone is safe, and there's been amazing work with the emergency services in Cairns and the Cairns Hospital and Health Service, and that's being worked through according to the plans for evacuation of any hotels. That's great news. The big thing about all of that, though, is whether it's new strains, whether it's quarantine arrivals, it's about getting vaccinated in Queensland. And as the Minister has said, we're getting closer and closer to that 80%, and the only way we'll get to 80% is if people come forward and get vaccinated. So if you haven't been, come forward, get vaccinated. Thank you.
Good morning. Here at QPAC, we've been prepared for this inevitability, and so from the 17th of December, all our patrons and staff will need to be double vaccinated going forward. Our industry is one of those industries that has really suffered most through COVID, and our artists need to be able to travel interstate and stay connected overseas, and the best way to keep them safe is if we all are double vaccinated. It's extremely important for our sector to survive that people are able to move freely, and the only way to do that is through vaccination. Here at QPAC, we've been preparing for this, and because of the COVID testing, we've been able to, the actual contact tracing, we've been able to develop a system here where all our patrons use the app on entry. This will be a really simple process where patrons will be able to show through this their app that they will be able to show their vaccination status. For those people who don't have the ability to use a smartphone, then we will have staff there to assist them. And for those people who unfortunately would still not be vaccinated, they'll be entitled to a complete refund. So I think the best way forward for all our sector is if everyone stays totally vaccinated. We've got a really big program going forward. We come from Christmas Carol into the ballet later on the year, and then we've got a number of shows throughout January and February that really rely on everybody and all our community working together. So we're very much in the place of asking all our staff members and all our community members to be double vaccinated. Thank you.
All right, any questions?
Minister, is there any way of telling how many people are in Queensland that have come from those countries where that new variant?
That might be a better question for the CHO. Yeah. Is there any questions for me while I'm standing here then?
On the vaccine app, it was revealed on Friday that anyone can connect their Medicare certificate to someone else's, so an unvaccinated person can pass off as vaccinated. Will the government update that on
So just to be really clear, that is a function of the app to be able to ensure that you can show that your children or your partner is also vaccinated. It takes a full process in that you have to download your own MyGov and Medicare Express account into that phone. So if you're giving away your personal details to somebody else for purposes that are not fit, then what you're actually doing is conducting fraud and identity theft. So there's no flaw in the actual check-in app. What you're describing is fraud, and that's illegal.
A lot of people will try and do that, though. In New South Wales, the app requires 2 proof of identity documents. Will the government look at doing anything to tighten that up, or is relying on the
just
trust?
to be very, very clear, the process is very tight and it's very clear. And of course, you can only access your Medicare Express details or your MyGov account if you log into it yourself and then connect it to somebody's phone. So you would be conducting fraud if you were doing that for purposes that are not legal.
Is there any way, though, to stop people from committing it? Do you have any way of fighting that?
You know, there are many things that we are always trying to ensure that people don't conduct illegal activity, just as it is illegal to drive a car. But there will be some people, to drive a car without a licence, of course, but there will be some people who will try to drive a car without a licence. And if they are caught, there will be, so there will be a fine, and the fine is very hefty, and that's been described already.
But if there are other safeguards that could be considered, like, for example, what Jackie was saying, the New South Wales system, how there has to be 2...
So just keeping in mind that the New South Wales system is one that stands alone in that they have a whole Services New South Wales program, and it's very different. We have the same check-in app as ACT, Tasmania and the Northern Territory, so we've been working together with the federal government on securing our ability to link vaccination certificates to the check-in app, and we're seeing that right across those other states as well. It's very, very clear on your app that you have a green bar for your name alone, and of course if you are logging in somebody else, then they would have a green bar or a tick. You can't pretend to be somebody else unless you conduct illegal activity.
But if there is a better system out there, and there is in New South Wales, wouldn't it be better to implement that and stop people being able to do it?
As I said, there are fines in place If people want to conduct fraud or identity theft, then there are fines and punishments for those. I would not encourage anybody to be giving away their identity, their personal details, and of course their log-on details to random people. You are exposing yourself to all kinds of other vulnerabilities if you start giving away those private details. And as I said, there's not a flaw in the app. What you're describing is fraud, and of course there are penalties for fraud and identity theft, not just in this state, but in all other states.
But if someone can commit fraud through an app, surely that is a flaw in the app, by the very nature of
As
it.
I've been very clear, it is not a flaw.
But it's fraud.
It is correct. And are you encouraging fraud?
Not at all, but we're highlighting that there's an issue with the app that people could expose it. We haven't shown
No,
people how to do it, but it's a safety concern.
So what is very, very clear, I've looked at what some of the descriptions have been that you've been promoting on in your stories. It would be incredibly difficult to do that. As I said, it's very clear on your own app when you check in and that when you've been vaccinated, that it's your name, and it is a green bar and tick that goes with that when you've checked in. If you've checked in another guest, then you'll see that same green bar against their name. You can't then say the green bar of the person that you've checked in as a guest is you. That's a different person altogether. So obviously, as I said, we've been working with ACT, who've been leading the check-in app design for not just their own state, but for Tasmania and for Queensland and for Northern Territory. We're all utilising the same app. And we've included these functions to make it easier to be able to prove vaccination, and we've been working with the federal government on being able to link those vaccination certificates to that app. And of course, as we've seen, the Check in Queensland app has been incredibly successful. Over 5 million downloads. We've seen millions and hundreds of millions of check-ins across Queensland, and already more than 700,000 Queenslanders have been able to link their vaccination certificate to the Check in Queensland app. And I would encourage Queenslanders to do that. As we move forward to the 17th of December, it'll make it easier to be able to prove your vaccination, but of course it's not the only way to do that. You can access your COVID-19 vaccination certificate on your MyGov account and utilise those printed versions, etc., that are available to people as well. This is just an easier version.
When you check in from December 17, so do you do that with the barcode and it picks up that you're vaccinated, or are we going to have police or staff at venues checking for the green tick?
So where businesses have to be able to monitor if they're being able to comply with the health directive, they'll be able to see from the actual person's check-in whether they've got a green bar or not. And so once you've linked your vaccination certificate to your check-in app, every time you check in, that green bar will come up. In fact, even when you haven't checked in, you'll see on the front that you've got a green tick against your name to prove that you've been able to link your vaccination certificate to your actual identity.
Will staff have to look, though, for every patron, they'll have to check every single check-in?
So
Like,
as you know already, when people check in, it is mandated that people need to check into various venues and locations and businesses across Queensland. So that is already a practice that's underway. And as John just explained, they're certainly going to be doing that here at QPAC, as has been the practice already with the mandated check-in process.
I guess the thing Miles was getting at is that a lot of places now, like you go to shopping centres, pretty much anywhere, no one's really actually checking when you're checking in.
Yeah,
They'll
but
say,
just
"Have
to
you
be-
checked in?" Yes.
Just to be very clear,
So
though,
there will be people stationed at the front of any facility that you go into that will want to see that.
so businesses are required under the health directive and the mandate to ensure those businesses that are affected by the mandate. I mean, obviously, if you're wanting to go and visit somebody at a healthcare facility, at an aged care facility, then there's a reason why it's been mandated that you need to prove that you've been vaccinated. And this process makes it really easy for staff and for Queenslanders to be able to move through into that facility in a safe way and prove that they've been vaccinated. there are particular locations and particular businesses that have been identified in the health directive as part of the mandate for the 17th of December. This is just an easier way to be able to do that. Like I said, there are other ways. You can download and print out your vaccination certificate. There are other ways to be able to do that. This just makes it easier for people.
So businesses will just look for the green tick, you don't need to show that as well?
You can also use your Apple wallet or your Google wallet. I mean, there are other ways to be able to prove it. This is just an easier way, so it's right there on the front screen as you walk in. But you can just as easily not link it if you wish and open up your Google wallet or your Apple wallet and prove your green tick, or go into your MyGov account every time you go into a business and prove that you've got your vaccination, or you can print it and utilise it with your ID. There's lots of ways to be able to do it. This is just a really easy way to make it easier for businesses to comply with the mandate, and easier, of course, for Queenslanders to move about and enjoy our freedoms. Once we're all vaccinated, we get to enjoy our freedoms in Queensland, like coming to a spectacular place like this and enjoying Christmas productions over the Christmas and festive season.
If we could.
Yeah, if I can ask just what I was asking before. Do we know how many people in Queensland at the moment have been in those danger zones in the last few days? The last couple of weeks and have arrived back in?
Yeah, the Commonwealth has been working through their data to identify everyone who's come from those 9 countries, but South Africa is the main focus, obviously. And they've provided us with the names of a number of people, and we've checked on their whereabouts, and they're all in hotel quarantine, which is wonderful. The Commonwealth has also asked if anybody else has come through and is in the community, whether it's primarily New South Wales, Victoria and ACT, because they aren't going into hotel quarantine until now, to come forward, identify themselves and get tested. And if there is anyone in Queensland in that group, please do that. But at this stage, the names and numbers we've got are all in hotel quarantine that have come from those countries.
How many are there?
Tested positive?
Less than 10.
And have any tested positive at this stage?
None at this stage.
There's reports this morning that several state and territory chief health officers pushed for a temporary pause on all overseas arrivals at that AHPPC meeting. Did you advocate for that?
Look, at this stage, there's different arrangements in different jurisdictions at the moment. For Queensland, Western Australia, South Australia, international arrivals are going into hotel quarantine. For those jurisdictions that have opened up, there are different concerns, and they're obviously looking at different ways of managing those numbers that are coming through.
Did you advocate for a pause, though, on all overseas arrivals?
I think all the chief health officers were in agreement that we do need to buy time to look at understanding the virus better. And at this stage, the Commonwealth has issued a mandate that no one can come from those countries and flights. Australians can still come through, but they need to go into hotel quarantine. And that's a safe way to do things until we know more about the virus.
Could buying time have any impact on our border reopening?
No, at this stage the pause is for 14 days, and that for us works really well because we're roughly about that till we open up our borders. But that gives us time, and 2 weeks is a reasonable period of time. We can certainly get information about transmission and severity of illness. We may need a little bit longer to fully understand the vaccine effects, but we'll certainly be able to watch what happens and we'll be in a much better position. And we already know 1,000 times more today than we did 2 days ago about the virus.
And there was a fire in a quarantine hotel in Cairns this morning. Can you talk us through how Queensland Health is managing that now? They've all obviously been evacuated. How will they manage that given that these people are in quarantine because they've come from hotspots and could potentially have the virus?
So look, we're working through that. All the quarantine hotels in Queensland have well worked and rehearsed evacuation plans, and we've been through a number of evacuations previously. That's an integrated plan across the Hospital Health Service, Queensland Fire and Emergency Services, Queensland Police and the hotel management themselves. All the guests of that hotel have been evacuated. They are all well, which is wonderful news, and they're all being grouped, reassessed at the moment and supported, and then we'll work through with them all as to their ability to use the Pacific Hotel in Cairns where the fire occurred and be able to either house them there, depending on the level of damage that's occurred, or consider moving them to other hotels in Cairns, and we do have another quarantine hotel in Cairns, or if need be, move them to Brisbane where there is existing quarantine capacity space. They will all be tested and they will all be looked at and continue their quarantine journey safely.
Do they have to restart their quarantine, any of those people?
No, we'll look to make sure that doesn't happen. That'll also depend on whether anyone tests positive, but we'll work through that.
Is there anyone currently positive amongst that group?
No.
Where are they now? Where are they now?
They're at an evacuation point in Cairns at the moment.
Okay. And were any staff put at risk, like will they have to go into isolation as a precaution, given there were people being evacuated?
No, we've worked with Queensland Fire and Emergency Services and local emergency services, and those staff were either in PPE or those that weren't. We're working through with those, but at this stage it'll be a test and observe policy, but no exposures of concern.
And of those people that have come from those 9 countries that are here in Queensland in hotel quarantine, if any of them do present with coronavirus, is their treatment going to be any different given how little we sort of know about the variant?
No, look, at this stage, our end-to-end infection control process for quarantine hotels and for identification of positive cases is based on infection control and stopping spread. What we do routinely is anybody who tests positive, we do genomic analysis, and that's a routine. Our forensic and scientific services do a wonderful job, and we have turnaround times within 24 hours for genomic analysis. So when someone does test positive, we'll get that result back under 24 hours to determine if it is the variant of concern or if it's what is now our standard Delta strain.
In light of the new strain, can you guarantee that the border will still open at 80% double dose to those domestic hotspots?
Look, I think that's a hypothetical. I can't put a 100% guarantee on anything, but we're watching, and at this stage there is no need to do anything different, because at this stage there's no significant change in severity of illness or any leak of vaccine effect with this new strain.
At what point, though, is that decision made, given that the border, as you said, we're sitting around December 6th?
We'll make that decision when there's evidence available that needs a change in position, but at this stage there's no evidence available to support a change in position.
And I just want to check the people, you said there were fewer than 10 people who come in from those African countries. Where are they in hotel quarantine?
They're in hotel quarantine, but I'm not going to tell you which hotels. I think that's unfair on the privacy.
What about a city? Brisbane or up north?
Well, our quarantine hotels are Brisbane, Gold Coast and Cairns, so 3...
Any in Cairns, though, at that
No.
specific hotel? Okay. And the 3 interstate arrivals that tested positive in hotel quarantine, which state did they come from?
They've come from Melbourne.
Right. Thank you.
All good. Thanks all.
Thank you.